Hello everyone. I am sorry for the delay in this video because this video is going to be covering three of the most important anatomical structures in the head and neck region for an OMFS and anyone who is seeking to do PG in OMFS or MDIS aspirants. Now these three anatomical structures are extremely important for us in particular because they are supplying the areas where we generally operate or where we generally deal with lesions or where we know that this anatomy is going to be affecting our treatment modalities. So we're going to start off because this video is going to be a bit long because it is covering three of the most important structures. Going to be covering three important structures, that is fifth, seventh and ninth cranial nerve. Fifth, seventh and ninth cranial nerve. What are those? Fifth, as the name itself is given, is known as trigeminal. Seventh is known as facial. Ninth is known as glossopharyngeal. Glossopharyngeal. Now, if you look at their names are quite self-explanatory. But still, we'll go into the brief overview of all three cranial nerves. We will try to cover them as fast as possible. Once again, this lecture is intended for MDiS aspirants and people who are interested in OMFS in future. But this is not for postgraduates. Why? Because for postgraduates, basically there are two essential details which are not going to be covered in this video but in a separate video altogether, in which we'll cover individual branch and individual nerve in whatever surgeries they are being used and what is important. So two specific details that any lecture should have for a postgraduate level is the anatomical variation and measurements. So for example, in the last video, if you remember, we discussed about oculomotor nerve. So we just discussed that it entered superior orbital foramen. But what are the variations? In how much percentage of the people it goes to the CTR, that is common tendinous ring. Common tendinous ring. That is a structure in the foramen of superior orbital fissure. So superior orbital fissure looks something like this. So there is a center, in the center there is common tendinous ring, CTR, which is responsible for attachment of your rectus muscles. Attachment of rectus muscles. For more detail, what are rectus muscles, you can watch our previous video that is on third, fourth and sixth cranial nerves. But I'm just giving an example that these variations are very important, firstly. Secondly, what is important for a postgraduate is, if let's say we are talking about oculomotor's branch that is supplying the superior branch, which supplies your LPS, that is levator palpebrae superioris. So when you're operating on a level of, let's say, NOE fracture, or let's say Lee Fort 3, so it becomes extremely important for us that what are going to be the measurements of our dissection from the nerve so that the nerve is not hampered. So these two details kind of makes up a lot of postgraduate stuff. Anyways, we are not going to be looking at the postgraduate stuff in this videos. I was just giving an example. What are we not going to be covering in this, and we are going to be taking a separate video on that. In any way, we will start off now because once again I'm telling you, facial, fifth, seventh and your ninth cranial nerves are quite something. So this video might extend for a long time. Please be patient and watch the video entirely. It will explain a lot of things. So now we'll start off with trigeminal first. So starting off with trigeminal nerve is a fifth cranial nerve that is very much we are aware of. Right now, if you remember our first video on cranial nerves, that is the last video also. In that video, we discussed about how our cranial nerves follow a very equitable distribution. So third, fourth were from midbrain, 5, 6, 7, 8 were from your 5, 6, 7, 8 were from your pons. So trigeminal is fifth, so it will arise from pons. So we will try to make a structure somehow. Yeah, I think this will do. Let's say this is our pons roughly. This is your midbrain. Now we are not related to midbrain, so we'll just delete this off. Anyways, what we should know about is your pons, and your further we'll just discuss about a little bit about thalamus also. Now every cranial nerve originates from nucleus. So trigeminal has four nucleuses, which are in, as we just know, which are in pons. So if you look at this way, and now I am taking a transverse section like this at the same time to show you how the nucleuses are. So if you look at this transverse section over here of pons, this is not the exact transverse section. Transverse section doesn't look like this, but anyways, you will have a sensory nucleus here, and on the lateral side you will have a motor nucleus. So these are the two main nucleuses of trigeminal nerve. One is sensory and one is motor. Motor is lateral and sensory is medially, right? I hope this much is clear. Now we'll start off. So your sensory is here. Let's name it, or we'll just mark it as S only, better. This is your sensory nucleus. This is your motor nucleus. Now at the same time there is another nucleus which is a little bit long, which is known as spinal nucleus, also known as bulbospinal nucleus. Bulbospinal nucleus, and superior to these three is another nucleus known as mesencephalic nucleus. Mesencephalic nucleus. So these are the four nucleuses which we have discussed over here, which constitute your trigeminal nerve. Now why I have written as 3 plus 1? Because 3 are sensory in nature and 1 is motor in nature. So this is a motor nuclei, so obviously it will give off a motor nerve. These three, principal sensory, let us call it as principal sensory, mesencephalic and bulbospinal are sensory in nature. So they give off branches. They give off your branches. 1, 2, 3. Once again, this is a schematic diagram. This is not the most precise diagram. Motor will draw from another way. Here you are traveling. Now they come out of the brain. Remember this. Remember this important detail. They come out of the brain. Now, if you remember our lecture on introduction to neuron, in that I have told you a collection of cell bodies inside the CNS is known as nucleus, whereas these nerves now they are going to a collection of cell bodies outside the CNS. So that structure is known as trigeminal ganglion. Trigeminal ganglion. They are known as trigeminal ganglion. Now notice something over here. And with the green wheel. So if you notice something over here, motor nerve fibers of the trigeminal motor nuclei, they do not relay on the nucleus as ganglion as such. They just pass through it. Whereas sensory root, if you look at the three sensory roots, they combine together, they are going to be relaying over here, and then they come out of the ganglion, and then they come out of the ganglion. They do not come like this actually. They come out in a more organized way, but I'm just telling they are going to relay and come out. Motor nerve fibers are not going to relay. Anyways, moving forward. Now talking a little bit about the trigeminal ganglion. It is a neural crest derivative. It is a neural crest derivative. It has unipolar neurons. Now, whenever you study about trigeminal nerve, they say that you better study it from the ganglion because it makes it very easy. So if you study with respect to ganglion, anything that goes towards brain is known as central processes, and anything which goes away from the brain will be known as peripheral processes. Peripheral processes of the trigeminal nerve. The other terminologies which are being used are a little bit different in, let's say, in contextually. But as of now, we'll just remember that processes towards the brain are central processes away from the brain are known as peripheral processes of the trigeminal nerve. Now, central processes are a little short to study, so we'll cover them first and then we'll move forward. Now we'll zoom into this part. Over here, your different nucleuses are there. This is your sensory, this is your mesencephalic, this is your bulbospinal. It is a bit lengthy, and this is your motor nucleus, triangle. Now what happens is the ascending fibers of the sensory nucleus mesencephalic, they go up. Now you'll ask, up where? They give rise to a tract known as dorsal trigeminothalamic tract. Dorsal trigeminothalamic tract. They ascend upwards. So let us see in a kind of a short diagram. I'll draw properly this time. So here is your cerebral hemispheres. Here is your, let's say, pons. These three are there. So what they do is they give rise to dorsal trigeminothalamic tract. It crosses at the level of thalamus, forming something known as medial lemniscus, and it relays to sensory cortex over here. And it relays to sensory cortex in brain or sensory areas in brain. It has a certificate area numbers also, which we are not going to cover as of now. But understand this, that the sensations from your face are perceived by the opposite cerebral hemisphere. Sensations from your brain are being perceived by the opposite cerebral hemisphere because they are going to cross over, also known as decussation. They are going to cross over, which are known as medial lemniscus, at the level of thalamus. At the level of thalamus, they form a medial lemniscus, they cross over, and then they go to the sensory cortex in brain where the sensations are perceived. So this is your sensory tract, or it is also known as dorsal trigeminothalamic tract. It is also known as dorsal trigeminothalamic tract. Now understand this much. These fibers are coming from your motor nucleus, sensory nucleus, and mesencephalic. They are not coming from bulbospinal. Bulbospinal gives rise to its own tract, which is known as ventral trigeminothalamic tract. Ventral trigeminothalamic tract. Now you will ask that why there are going to be two different tracts for the same sensations, because it's not the same. The thing is, your dorsal fibers, they carry a different kind of sensations, whereas your spinal fibers, they carry a different kind of sensations. Now the thing is, they also grow in the same way. The ventral fibers also go like this, they cross over and they go to the sensory cortex only. So they are not doing anything special as such. But what they are going to do is they are going to carry the sensations of pain and temperature. Pain and temperature. Whereas dorsal is touch and pressure. Touch and pressure. Now, this is your dorsal and ventral trigeminothalamic tract, right? Now you will ask, what about mesencephalic? Mesencephalic, they carry a special sense, not a special sense actually. They carry a sensation, something known as proprioception. Proprioception. I gave an example, if you remember, in third, fourth, and sixth cranial nerve, that mesencephalic gives off nerves to almost entire body, but it is primarily a nucleus of fifth cranial nerve, and it is responsible for proprioception. Now you will ask, what is proprioception? Basically, movement felt from the joint. Now your joint performs very complex movements, and all those movements needs to be perceived in a very sensible, or in a very, let's say, in a very complex manner. So all those sensations are termed as proprioception, whereas you will need to detect the movement, at what angle the joint should move, and all those things. So that is known as proprioception, and that movement felt from the joint is known as proprioception, which is responsible, for whom it is responsible, sorry, and who is responsible for it? Mesencephalic nucleus is responsible for it. So mesencephalic is responsible for proprioception. Ventral trigeminothalamic tract arising from the spinal nucleus is responsible for your pain and temperature. Dorsal trigeminothalamic tract arising from your motor sensory nerve is known as touch and pressure. And this is going to be your central processes of the trigeminal nerve. I hope everything is clear as of now. I am rubbing it because I don't have a lot of pages for trigeminal, so I will be covering a lot of things extremely quickly. Now, since we have discussed about the central processes, now we are going on to the peripheral processes, which is a important question at the level of your undergraduates and at the level of your MDiS aspirants also. So what is this? So what we are going to do is, we are going to take this ganglion and we are going to make a good nerve over here. So from this nerve arises three branches. Now we'll just add more fibers to this one because it is larger. So these branches of trigeminal nerve are known as ophthalmic. This is the first V1. Maxillary, that is V2, and mandibular, that is V3. That is V3. So these are the peripheral process. Now we are going to come down and we are going to see ophthalmic first. I am making this in a very sort of like a semi-lunar shape. Why? Because there are some synonyms of trigeminal ganglion. It is also known as trigeminal ganglion. It is also known as semi-lunar ganglion. It is also known as Gasserian ganglion. It is located in a dural cave, which is also known as Meckel's cavity or Meckel's cave. Meckel's cave or cavity, which is in petrous temporal bone. Petrous temporal bone. Right. So this is a little bit about the ganglion. What is a dural cave? Dural cave is nothing but a fold of your duras to form a cave-like structure where your ganglion resides, and that is known as dural cave. Right. So this is your dural cave from which your branch arises. Now we are going to look at one branch, that is your ophthalmic division. Now ophthalmic division is purely sensory in nature. It will also go through the, now you will recognize this, it will also go through the lateral wall of the cavernous sinus, come out and go through superior orbital fissure only, and come out of superior orbital fissure, right? But what is your ophthalmic division going to supply? It gives off three branches: L, F, and lastly known as NC. What does LFNC stands for? L stands for lacrimal, F stands for frontal, and NC stands for nasociliary. Nasociliary. So these are branch of ophthalmic division, also known as V1. For the sake of convenience, I'm going to be writing ophthalmic as V1, maxillary as V2, and mandibular as V3. So kindly understand when I use the short forms. Now we will be looking at lacrimal. So as the name is very much suggestive, it will supply your lacrimal gland. Also it will supply skin over there, and also it will supply conjunctiva. Also it will supply your conjunctiva. Frontal is a bit more lengthier. It travels forward along the medial wall, medial wall and roof of the orbital cavity junction, where it divides almost when it comes out of the orbital cavity anteriorly. It divides. So this is your orbit. It kind of travels like this, and when it is just going to exit from your orbit, it divides into its two branches. This is what I mean. So your frontal nerve is going to divide into two branches. Now see, these are the areas supplied. Areas supplied. And that is sensory. Now note over here one thing. When lacrimal nerve supplies the lacrimal gland, it is doing sensory supply, or also known as it is receiving sensations from the salivary gland, lacrimal gland. It is not ordering the lacrimal gland to secrete tears, but the fibers which are responsible for the secretion travel along with lacrimal only. They travel along with lacrimal nerve only. They travel along with it, but they relay their order separately from the main lacrimal nerve. They relay their order separately. So let's say if I am lacrimal gland, if I am receiving my main supply from the lacrimal nerve of trigeminal ophthalmic division, I will listen to it and I will give it sensations. And along with the lacrimal, who is the main officer, will come another officer who will ask me to secrete tears. So that another officer is this another nerve. We understand it like this. Anyways, we'll not get into that as of now. We'll get into it when we'll study about maxillary division. It will help us clarify a lot of things. So now getting on to frontal. Frontal has two branches. One is supraorbital. Another is supratrochlear. One is supraorbital, one is supratrochlear. Supraorbital goes through a notch. This notch is known as supraorbital notch, and it supplies to some structures. First is frontal sinus, some areas of frontal sinus, skin over forehead, and a little bit to upper eyelid. Whereas supratrochlear, it's a parts. Now supratrochlear also supplies to upper eyelid, medial parts, and skin over medial part of forehead. Skin over medial part of forehead. So this is going to be the areas supplied by supraorbital, which travels through a supraorbital notch, giving supply to frontal sinus, skin over forehead, upper eyelid, a little parts, some lateral parts of it to be precise. Whereas supratrochlear, and again branch of frontal, again which is a branch of ophthalmic, which is the first division of trigeminal we are studying about. It supratrochlear gives rise upper eyelid medial parts and skin over medial parts of forehead. Whereas skin over forehead, this was also lateral in the case of supraorbital. Now nasociliary is a bit complicated. Why it is a bit complicated? Because it gives off branches in three divisions. It gives off branches in three divisions. What does that mean? So nasociliary, basically, what for the sake of convenience, its branches we are going to study at three levels: orbital branches, then nasal cavity branches, and terminal branches. Terminal branches. So nasociliary gives off branches at three levels. It is going to be very complicated if I take all the branches together. So I have divided them for the sake of ease into three parts. So first is the orbital branches. Orbital branches will start off from long root of ciliary ganglion. Now, if you remember ciliary ganglion from third cranial nerve from our last lecture, ciliary ganglion was responsible for two very important reflexes. That was accommodation reflex and light reflex. So, we should remember that. Also, it receives something very important. Now, if you remember, third, 7, 9, 10. I have explained about this in something known as craniosacral outflow, that is the parasympathetic nervous system responsible for involuntary actions of the human body. So I am revising this because it's going to play an important part over here. So let's us look at the long root of the ciliary ganglion. It does not relay at the ciliary ganglion, it just passes through it. First point. And the most important point, it forms the short ciliary nerve. It forms a short ciliary nerve. That is your orbital cavity's first branch. It has a long or sensory root which arises from the ganglion, but it doesn't relay as such. Continues to eyeball with the help of short ciliary nerve. Now we'll talk about long ciliary nerve. If there is short ciliary, there should be a long ciliary also. Long ciliary is nothing but sympathetic supply. Sympathetic supply of the eyeball. Now, if you remember, we talked about 3, 7, 9, 10 are responsible for parasympathetic. So, if some area of the human body is receiving parasympathetic supply, it should almost always should receive a sympathetic supply also, and they have a very opposite action except for one thing. In one case and only one case, sympathetic and parasympathetic carry out the same action, and that is secretion. Except of that secretion part, almost in all actions parasympathetic and sympathetic oppose each other. They are complete opposite of each other except for secretion part. They both are responsible for increasing the secretions. Anyways, so long ciliary nerve is the sympathetic supply. Then we have the third nerve known as posterior ethmoid. Nerve. This is a bit easy. It supplies posterior ethmoid sinus and it supplies sphenoid sinus mucosa. Basically, it supplies sinus mucosa for sensations. And the last is anterior ethmoid nerve. So one thing is very clear, it is going to be supplying anterior ethmoid sinus, frontal sinus, right? Now what it does is, anterior ethmoid continues and gives off the branches of the nasal cavity level. So this is your branches at the level of orbit. What are the branches at the level of orbit? One was long root of the ciliary ganglion giving rise to short ciliary nerve. Then there was a long ciliary nerve. which was responsible for sympathetic supply. Then there was a posterior ethmoidal nerve, which is responsible for posterior ethmoidal sinus, inner sinus mucosa. And then there was an anterior ethmoidal nerve. It first of all it supplies anterior ethmoid sinus, frontal sinus, and then it continues to give off branches at nasal cavity level. I hope this much is clear. So now we will see at the nasal cavity level what is going on. At the nasal cavity level, what is going on? At the nasal cavity level, your anterior ethmoid continues. So what does it do? It gives off two branches: external nasal, internal nasal. External nasal, internal nasal. These are branches of your anterior ethmoid continuation. Now, internal nasal is again divided into two parts. One is septal, another is lateral. One is septal, another is lateral. These are branches at the nasal cavity level. So, septal, what are we going to do? Basically, septum mucosa. As the name is very much suggestive, it supplies septum mucosa, right? Whereas lateral, what they do? They give a branch to mucosa, first of all, of your turbinates, that is superior and middle nasal concha, that is turbinate bones. Turbinate bones are nothing but superior, middle, and inferior nasal concha. Superior, middle, and inferior nasal concha. Right? Now, what about external nasal? Now, at the border between the lower edge of the nasal bone and upper edge of the cartilage, the external nasal supplies the tip of the nose. Tip of the nose is supplied by external nasal. Now, remember this one important thing. Rest of the lateral nose, that the nose you touch from the sides, is supplied by maxillary. Only the tip is supplied by ophthalmic. Only the tip. When you touch the tip of your nose, it is supplied by ophthalmic. You are stimulating ophthalmic. But when you touch the rest of your nose, it is being supplied by maxillary. So we'll remember this detail because it is helpful. So external nasal supplies the skin over tip of nose. Skin over tip of nose. Where does it come out? It comes out between the junction of nasal bone and nasal cartilage. Nasal bone and nasal cartilage. So this is your branches at the level of nasal cavity. Now a few of the terminal branches are also there, which supply the medial part of the eyelids, lacrimal, caruncle, and all those areas, which are not that of relevance to us. So this is your primarily ophthalmic division. This is your primarily ophthalmic division. So I hope everyone has written all this. Now we are going to go to maxillary division. We'll be talking about maxillary division, which is a large division as well. Before we go on to maxillary division, there is one more thing that I will mention about ophthalmic, or basically in trigeminal actually. Let's go up. All the branches of trigeminal nerve, they give off a recurrent branch. They give off a recurrent branch. What does a recurrent branch mean? Recurrent branch means a branch which will go back. Which will go back. Now, why is this going back? Because trigeminal nerve has been given an important duty of receiving sensations from your dura. So all three of them, they send off one branch back to receive sensations from dura. Ophthalmic gives something known as nervous tentori, something known as nervous tentori, right? Maxillary, it gives something known as middle meningeal nerve, and mandibular also gives one branch which is known as nervous spinosum. Nervous spinosum. So all three branches of trigeminal nerve, they send off a branch back to supply dura, and these are the names: ophthalmics, nervous tentori; maxillaries is middle meningeal; mandibular is nervous spinosum. Right? Now we'll go back to your maxillary nerve. Now when we start off with maxillary, again for the sake of making it easier, we are going to study maxillary in parts. So maxillary, first of all, is the second division. Then it also travels through the lateral wall of cavernous sinus. So as of now we know there are four important structures: third, fourth, V1, V2. These are four structures traveling through the lateral wall, and only one structure, that is sixth cranial nerve, traveling through the cavernous sinus. So if you being asked a question, if there is a lesion in cavernous sinus, which muscle will be affected? Now you know the answer: SO4, LR6, 6 supplies, LR, lateral rectors. So now you know any lesion at the level of cavernous sinus will affect your lateral rectus function, and you know the reason why now. So we are clear about this concept. So going back, we'll talk about the second division, which travels through the lateral wall of the cavernous sinus, and it comes out through a foramen known as foramen rotundum. Foramen rotundum. It comes out of the skull from a foramen known as foramen rotundum, which is in middle cranial fossa. So it comes out. Now you know already that it is a given of a branch which comes back, also known as middle meningeal. M for maxillary, M for middle meningeal. M for maxillary, M for middle meningeal. So we are going to completely ignore middle meningeal now from now on, and we are going to study about the rest of the branches. Now for the sake of making it easy, what we are going to do is, first we know about middle meningeal, now we want to make it easy. As soon as it comes out of the foramen, as soon as the maxillary division comes out, it forms a fellow over here known as PPG, that is known as pterygopalatine ganglion, also known as SPG, that is phenopalatine ganglion. Palatine ganglion. Now what this ganglion brother does it, as soon as it comes out, it forms. Now which is this region where it comes out? This is known as ITF, that is infratemporal fossa. Which is known as infratemporal fossa. Basically this is behind the maxilla. All this is happening behind your maxilla. Now at this level, at the level of pterygopalatine fossa, at the level of pterygopalatine fossa, it's not infratemporal, it's pterygopalatine fossa region, it gives off branches. What are these branches? First branch is known as zygomatic. First branch is known as zygomatic. Second branch is known as pterygopalatine. Pterygopalatine. Now third branch is known as palatine. Third branch is known as, sorry, I beg your pardon. Pterygopalatine's branch is palatine. Third branch is known as PSA. Third branch is known as PSA. Now what is PSA gonna do? We're gonna see. And then out of all this, one continuation happens which enters a fissure known as inferior orbital fissure. Now what we studying right now is the nerve between rotundum and inferior orbital fissure, and what are the branches it is giving between in this distance. So in between this distance, what are the branches coming? We are studying those branches. So it gives off a ganglion, and these are the ganglionic branches. Ganglionic branches are zygomatic, pterygopalatine, and PSA. So starting from zygomatic gives off two branches. Again, we are studying maxillary right now. We are not on ophthalmic anymore. Zygomatic gives off two branches, ZT and ZF. Zygomaticofacial and zygomaticotemporal. Zygomaticotemporal leaves the orbit between the great wing of sphenoid and zygomatic bone to enter the temporal fossa, and it supplies the anterior temporal fossa region. Anterior temporal fossa region. Whereas ZF, it pierces orbicularis oculi muscle. First point. Second, it supplies the area over the cheek. It supplies the skin over cheek prominence. Over cheek prominence. So whatever cheek prominence you can feel right now just beneath your eye, that skin is supplied by ZF. Whereas a little bit lateral to the forehead, as soon as it turns back, that area is being supplied by ZT, that is zygomaticotemporal. Right? Now pterygopalatine we'll see. Now pterygopalatine itself is ganglionic branches of the pterygopalatine division of your maxillary, but we're going to study about it. It gives off four branches. It gives off four branches, that is orbital, nasal, palatal, and pharyngeal. And pharyngeal. So these are the four branches of the These are the four branches of the ganglionic branch or the pterygopalatine branch of your maxillary nerve at the level of pterygopalatine fossa. So what is orbital branch gonna do? So orbital branch is going to supply the periosteum of orbit first. Secondly, it will also supply some part of posterior ethmoid sinus, some parts of it, not the entire thing. That's it. Then you go on to the nasal branches. Nasal branches are again divided into two. That is superior lateral and septal. Now remember this superior lateral and septal branch were also found in your ophthalmic division's anterior ethmoidal nerve as well. But here it is a different branch altogether. It supplies your mucosa. This also supplies your mucosa over the septum, and this supplies the mucosa over the nasal mucous membrane. Mucosa, that is nasal mucosa on the lateral inner lateral wall. Now there is a doubt that is coming into all of our minds, that why there is dual supply? Why is there a dual supply for this? Now if you remember one thing, on a totally unrelated thing, mucosa not only has sensation but it also secretes mucus. Gland such as lacrimal or any salivary gland, it not only sends signal, that is sensory, it also secretes, that is known as secretomotor function. Now ophthalmic, listen to this very carefully. Ophthalmic is responsible for sensations over here, but what maxilla is doing right now, this is not only sensory, plus it is secretory function also. It is secretory function also. What is maxillary branches doing? Now a question will come to your mind, sir, like how is the secretory function coming from? Where is it coming from? We will learn about it in a little while, but let's as of now just understand that secretory function is also being carried by maxilla right now. Ophthalmic over here was sensory, pure sensory function, nothing else, pure sensory function, whereas this function is secretory also, that is an added function over here. Now we'll talk about palatine. So palatal branch of the pterygopalatine nerve of maxillary nerve. We are into parietal branch now. Parietal branch gives off two branches. Greater palatine, the famous greater palatine block branch, that is the greater palatine, and lesser. Some people say that there is a middle also, but that is highly reliable. Now basically there is a middle and a posterior, they tell, that supplies the posterior pharynx, palate and pharynx region, whereas this supplies the soft palate, this supplies the hard palate. Hard palate, soft palate, posterior palate and pharynx. This is the supply of the palatal. Pharyngeal again will go into oropharynx proper. Oropharynx. Now remember all the functions. This is not just sensory, this is secretory also. Right? And now we will come on to the last branch in the pterygopalatine fossa region, that is PSA. PSA enters into maxilla from behind, goes there, and it supplies three tooth, that is if your 8 is present, your 7 is present, and your 6 is present. But in the case of 6, there is an exception. In 78% of the people, it leaves or does not supply mesiobuccal root. So why is this detail important? Because while giving local anesthesia, it becomes additionally important to give an additional block at that local region so that your upper six gets completely anesthetized. Then the question comes, who supplies the mesiobuccal root? Now we'll get on to that question also. But as of now, we can just remember that PSA will supply this region, that is these three tooth it will supply. Also what it does is it supplies buccal gingiva of these tooth. Buccal gingiva of these three tooth only. PSA will supply. Right? So what PSA did? It entered into maxilla from behind. There were your three tooth waiting over here. It's not like that. It supplied them. It left the mesiobuccal root. This person is sad now. And then what it did? There was gingiva over here. It supplied gingiva also. So this is what is the function of PSA, and that is why you give a PSA block for dental extractions of these three tooth, that is upper 8, 7 and 6. Right. So these are the pterygopalatine fossa branches. These are the pterygopalatine fossa branches of your trigeminal nerve maxillary division. So what happens now? Now, if you remember one thing, over here we talked about that it continues in a fissure known as inferior orbital fissure. So let us look at the nerve, what happens inside the inferior orbital fissure. This is a transparent diagram of inferior orbital fissure. Over here your maxillary division is continuing. It gives off a branch at the level of premolars. Then it again continues, and before exiting on the outside of your skull, just lateral to your nose. Before exiting, it gives off another branch at the level of, let's say, incisors or canine region. So this is known as ASA, that is anterior superior alveolar, and this is known as middle superior alveolar. This is known as anterior, and sometimes MSA in 22% in MSA supplies the mesiobuccal root of your molar of first molar, that is 6, right? And that is why we give that block. And then it exits out. Then it exits out. So if you look at it at a person's face over here, this is nose, eyes, face. This is your foramen. From foramen it comes, it goes up, it goes down, it goes sideways. It goes towards the nose. So these are the three divisions that I'm drawn outside on the face. So in inferior orbital fissure, that is this transparent diagram, what happened? It supplied your middle superior alveolar, it went ahead, it supplied your anterior superior alveolar, that supplies your incisors and canine, and it also supplies buccal gingiva. Now you might be wondering, who is supplying the parietal gingiva? So we'll go back to our knowledge. This parietal branch of the maxillaris posterior parietal, this supplies your palatal gingiva. This supplies your parietal gingiva. Right. Now what are we going to do? Now the branches on the face. Now we have seen the branch inferior orbital canal. This canal opens on your face, which we can see over here. Once it opens on the face, it goes up. This is known as inferior palpebral. Inferior palpebral supplies your lower eyelid. It's in the name only. Inferior means lower, palpebral means eyelid. This area goes to supply the lateral part of the nose, and that's what the name is. Lateral nasal branch. Lateral nasal branch because it supplies the lateral part of the nose. Simple. And this lower branch, it supplies the upper lip. So it is known as superior labial branch. And this covers your maxillary division. And this covers your maxillary division. What's wrong with it? Okay, this much only. This covers your maxillary division. Now last but not the least, we will be talking about the mandibular division. Last but not the least, we have been talking about the mandibular division. Now mandibular division, first of all, is the largest. It does not go through cavernous sinus. It exits skull through something known as foramen ovale. Through something known as foramen ovale. Right? Now once it exits the skull, it comes out and it gives off a branch. It gives off a branch. So first of all, one more thing. It is the only division which is not purely sensory. It is sensory plus motor. It is sensory plus motor. Why is this relevant? I will tell you. So we will make a diagram to understand it better. Here is your foramen ovale. Here is your maxillary nerve. Sorry, mandibular nerve. It comes like this. We'll specialize a little because this has motor fibers also. So this is the motor fiber, these are the sensory fiber. Together it is your mandibular division which is coming out of your foramen ovale. And we will make the pen brown. Okay, brown pen is not there. Okay, so what are we going to do is we're going to make the pen somewhat of a common color. Let's say we make it yellow. So wherever separate supply will be needed, I will separate off the color. So over green represents your sensory and red represents your motor. right? So over here, the common branch is going, yellow nerve is going. First, it gives off a branch. This branch supplies your medial pterygoid muscle. Medial pterygoid muscle. It also supplies two other muscles, that is tensor tympani and tensor veli palatini. So three muscles. Now remember one thing over here. Trigeminal nerve is not responsible for motor supply for a lot of facial muscles. Almost your entire facial muscles are being supplied by facial nerve, which we will study. But the thing is, trigeminal nerve is responsible for motor function of a few muscles, on your face, and those muscles which we going to are being supplied by one and the only branch of trigeminal, mandibular. Now, mandibular is responsible for motor function of medial pterygoid, tensor tympani, and tensor veli palatini. These two are related to palate and middle ear. Are related to palate. So, palatini is related to palate, tympani is related to middle ear. How they are related, we are still gonna study properly. But as of now, just remember these three muscles: motor function, motor function. So, I'm gonna make it more specific right now. This is going to be red fibers coming, so that there is no confusion. So motor along with sensory also. So yellow was actually the right term. Are coming. They are going to be supplying for sensations as well as the motor supply. Right. Now this nerve will continue back. This nerve will continue. And it gives off two branches. Now do you remember, you have four muscles of mastication. Four muscles of mastication. Out of this, one medial pterygoid has already been supplied. So this branch of your mandibular division is known as anterior division. It supplies the rest of the muscles. It supplies the rest of your muscles of mastication. Three muscles which are left: masseter, temporalis, and lateral pterygoid. And lateral pterygoid. And lateral pterygoid. Now this also gives off an additional branch to a structure which pierces buccinator but doesn't supply it. This is a very important question because people ask this. This branch is also known as buccal branch. This branch is, sorry, I'll draw it with green because this is completely sensory branch. This is also known as buccal branch or long buccal branch, which is also one of the common blocks we give for mandibular extraction, long buccal branch. So it pierces buccinator, but it supplies the buccal mucosa. It supplies the buccal mucosa and buccal gingiva. Buccal gingiva of where? 876 region. So we understood one thing. You had a mandibular division. It gave off a branch to medial pterygoid, tensor veli tympani, and tensor veli palatini, tensor tympani. It continued forward. It divided into two branches. Anterior division. Anterior division supplies rest of the remaining masticatory muscles, that is masseter, temporalis, and lateral pterygoid. It gave off an additional branch which is known as long buccal branch, which needs to be blocked for mandibular extractions. It pierces the buccinator muscle but doesn't supply. Then who supplies? Facial supplies. And it goes off to supply buccal mucosa and buccal gingiva of what tooth? 876. Only these tooth, gingiva, not the tooth, not the tooth, only gingiva, not the tooth. Remember this part. Not the tooth, only gingiva. Now here was the motor function. Here it was completely sensory, right? This is your anterior division. Now we'll talk about your posterior division of the mandibular nerve. Now we'll be talking about the posterior division of the mandibular nerve. In the posterior division, there are three important branches. In the posterior division, there are three very important branches. I'll show you guys it. I need to draw a diagram. Okay, how to draw this? Okay, yeah. So posterior division continues something like, okay, so here it is your posterior division. It will continue. It will go sideways. It will go straight forward. It will go down. One is your lingual. Another is known as inferior alveolar. And this first division is actually, there are two roots which form a single nerve, which is known as AT, that is auriculotemporal. So your posterior division of the mandibular nerve is divided into three branches, which is auriculotemporal, lingual, and inferior alveolar. Auriculotemporal, lingual, and inferior alveolar. We'll talk about inferior alveolar first. In the case of inferior alveolar, it gives off two branches. This motor supply of inferior alveolar goes to muscles, that is mylohyoid and anterior belly of digastric So motor supply is by mylohyoid and anterior belly of digastric. What about the sensory supply? Sensory supply will go to this is a very bad tooth representation. Please do not believe this. It will enter a foramen known as mandibular foramen in the medial side of the ramus, and it will supply one half of the mandibular tooth. One half of the mandibular tooth. Now remember one thing important over here. Buccal gingiva was supplied by long buccal nerve. Tooth are supplied by inferior alveolar nerve. But what about the buccal gingiva of the rest? It is supplied by a continuation of inferior alveolar, which comes out of mental foramen at the level of premolar, known as mental nerve, which supplies the gingiva over here, which supplies the gingiva anterior to 6. So here will be your mental nerve supplying gingiva from 5, 4, 3, 2, 1, along with a nerve known as incisive nerve. Inferior alveolar, it supplies the tooth proper. It supplies the tooth proper of one half. This is your inferior alveolar. Talking about lingual, it supplies one half of the tongue. That is sensory supply. One more thing, along with the tongue sensory, that is anterior two-third. Now tongue is divided into anterior two-third and posterior two-third. So anterior two-third is being of one half is supplied by lingual nerve, the other half will be supplied by that half's lingual nerve. So tongue, along with the ganglion known as submandibular ganglion, which is responsible for secretions from submandibular gland and sublingual gland. These fibers also come along with lingual. Does lingual do the secretion part? The answer is no. Secretion part is done by someone else. The order of secretion is not given by lingual, but a partner of lingual which comes along with it. Who is that partner? We'll discuss later. But just understand right now, sensations is bilingual. This secretion part is not lingual. So only the sensory part of both the things is bilingual. Secretory part is not bilingual. It is a partner of lingual which comes along with the it. What example I gave in the case of lacrimal, it is almost the same thing. Now in the case of auriculotemporal, and we will finish off our trigeminal lecture. I think trigeminal lecture itself has taken a lot of time. So I'm going to make a facial and glossopharyngeal a separate video. But auriculotemporal will finish it off. Auriculotemporal has two roots. I have already showed over here. Two roots are there. Now where does it supply? Auriculotemporal supplies first is parotid gland. Parotid gland. Again, this is sensory. One of the auriculotemporal partner is also there. We'll draw the partner in a different color. Pink we'll draw. This partner is also coming. This partner orders your parotid to secrete. But does the auriculotemporal do the job? And the answer is no. Auriculotemporal only receives sensations. That's it. It is the partner of the auriculotemporal nerve branch that gives the order to secrete. Right? So this is the first branch, that is the parotid branch. Next is articular branch going off to TMJ. Another is auricular branch. Auricular means branches to ears. Branches to ears, more precisely helix and tragus. Helix and tragus. Right? And one is meatal branch. Meatal branch is external auditory meatus. So skin lining the meatus, skin over meatus, and outside of tympanic membrane. And outside of tympanic membrane. Right. So the auriculotemporal some branches also supply the skin of scalp. Skin of scalp. So these are the 5 branches. Skin of scalp sensory supply, tragus, helix tragus sensory supply, parotid sensory supply, also secretory, articular, that is TMJ supply, and then you have meatal, that is skin over outside over the meatus and outside of tympanic membrane. This this finishes off our mandibular maxillary and division. We'll try to summarize it. So we had a trigeminal nerve. It had nucleus 3, 1. 1 is motor, 3 is sensory. They form medial lemniscus of the thalamus. They go to sensory cortex. Motor will obviously go to motor cortex. Right? They have central process. I better write central over here. They have central process, which are coming from here only. We have peripheral process. Peripheral will have 3 divisions: V1, V2, V3. V1 is ophthalmic, give off 3 branches: lacrimal, nasociliary, frontal. Frontal gives off 2: supratrochlear, supraorbital. Nasociliary gives off 4: long root, also known as short ciliary, long ciliary, anterior ethmoidal, posterior ethmoidal. Right? If you remember, anterior ethmoidal itself gives off 2 branches more, that were your orbital branches and nasal branches. We will not go into that. We're just giving a revision as of now. Coming back, we have V2 that is maxillary. It gives off first three branches at PPF level, zygomatico-frontal and zygomatico-temporal. Then it will also give ganglionic branches. That was your palatine, nasal, pharyngeal. Then it gave off another branch that was PSA. It continued in infraorbital fissure and it gave off MSA and ASA. Then it again continued on face. It gave off another three branches: lateral nasal, inferior palpebral, and superior labial. Then V3, it gave off three branches. First is medial pterygoid branch, anterior division, posterior division, anterior division rest of the three muscles, temporalis, masseter, and lastly lateral pterygoid. And last is your posterior division. It gives off a mylohyoid branch, inferior alveolar, auriculotemporal, lingual. Mylohyoid also supplies to anterior belly of digastric. My medial pterygoid branch also gives rise to tensor valli palatini and tensor tympani. Inferior alveolar, that is tooth, lingual, that is tongue, plus lingual gingiva. Auriculotemporal, again four branches were there: auricular, articular, that is TMJ, parotid, that is gland, sensory, and your last was meatal, that is external aortic meatus skin. This summarizes your trigeminal nerve. I hope this cleared a lot of concepts for us. More will be coming in the further videos. Thank you for paying attention for such a long amount of time. Keep learning, stay curious. Thank you. Have a nice day.